My name is Andrea Pennington. I'm an integrative physician, acupuncturist, best-selling author, and international speaker. I help doctors, therapists, coaches, speakers, and authors share their message with the world in the areas of resilience, trauma healing, and self-love. It's all part of my mission to elevate the level of consciousness in our world. After living for years, hiding depression and anxiety, I know how isolating and sickening it feels to be trapped, not living life aligned with your authentic self. As I've shared in my books and TED Talks, music saved my life and set me free from depression. And through a near-death experience, I reconnected with my soul and got a whole new vision to live for. Now, I combine my media communication experience with my professional expertise in meditation, neurofeedback, and holistic healing on stages, TV shows, and podcasts, in boardrooms and retreat centers around the world. My books, life writing programs, and brand mentoring academy are all designed to empower you to transform, heal, and thrive in business and in life. Hello, hello, beautiful soul. How are you doing? Welcome to another edition of Conscious Evolution. That's right, this is the place to be if you want to learn how to consciously evolve and transform into the highest and best version of you. I am Dr. Andrea Pennington, if you don't know who I am. Welcome. It is a pleasure to have you here. And it's a pleasure to be introducing you to someone who I think is going to bring you an interesting perspective on improving your mental health. If you have been watching any of my videos for the last week or so, then you know that this has been a very delicate time for me. In the last year and a half, I have lost two very dear friends, healthcare providers, to suicide. And having experienced depression myself and knowing how dark our thoughts can get, I wanted to have this conversation. One, so that we can destigmatize the whole conversation around mental health. Because your mind, your emotions, all of that needs to be looked after just as much as your cholesterol and your blood sugar levels. And it's really critical that you have a conversation with someone, whether it's with us here today or someone near and dear in your life. Because the number one thing that prevents people from getting better is staying silent. And I don't want that to be the case for you, my dear friend. So welcome. I am very excited that I get to introduce you to Dr. Hisla Bates. She is a board-certified, Harvard-trained pediatric and adolescent, also adult, psychiatrist. She's got over 20 years of experience treating and diagnosing severe mental illness. Now, Dr. Bates recently interviewed me on her own summit, Heal Yourself. And what's interesting is that she blends in a combination of positive psychology, mindfulness and meditation, and expressive arts. That's right, we're going to even talk about how art therapy and creativity can help you. So without further ado, welcome, Dr. Hisla Bates. Thank you so much for being with me.
Thank you so much, Dr. Pennington, for having me here. It's an honor to be here. Thank you.
Well, I'm so grateful for our recent connection, and I'm so grateful that you were so generous with your words of support as I have been grieving the loss of my dear friend. And as I shared with you, I was really saddened to find out that for months, my friend was just deteriorating. At one point, I knew that she had dealt with depression in her life before, but she was apparently put on a medication, and the medication sort of blunted the depression, but it sent her into insomnia. So that caused her to feel even worse. And ultimately, one of the doctors gave her a benzodiazepine to kind of calm down some of the anxiety and the panic attacks. But that apparently is what really unraveled her mental state. And she got to the point where she really didn't want to be in this life anymore. She couldn't see an end to the suffering. And for me personally, having experienced depression, I know how it can be when our thoughts become so dark. Even if you're not at the point of like psychosis, there gets to be this feeling like maybe this is never going to get better. Is that also your experience in treating patients?
Yes, absolutely. I think with medications as well, sometimes medications don't work for everyone. And I think what can happen is that someone will go on a medication, they'll feel worse. They won't tell their doctor that they're feeling worse, and they become more hopeless. They feel like this is the medication that's supposed to help me, it's supposed to make me feel better. I'm not feeling better. And then they become very hopeless. And that's the worry about just having one modality to heal depression. I think it's really important that psychiatrists open themselves up to other forms of treatment because medication doesn't work for everyone in the way it's supposed to.
And so when you talk about these, having psychiatrists open up to other possibilities, what exactly do you mean? Obviously, you've gone out of your way to get additional training. But what would you say to the average psychiatrist or to someone who thinks that they may want to reach out to a psychiatrist?
Yeah. So, when I started my training, it was in the 80s. And at that time, a lot of the antidepressants were very popular, and also the atypical antipsychotic agents, also very common. And we use them pretty liberally. And so medication became more important than psychotherapy after a while. And I think now psychiatrists are being called prescribers. And it's unfortunate because a lot of our role has become distributing medications. And so oftentimes patients will see a psychiatrist very briefly for anywhere between 15 minutes to 30 minutes and be prescribed a medication. And then they might see their psychiatrist once a month. Now, what can happen, hopefully they're seeing a therapist at the same time. But what can happen is that they may have something else going on. A lot of times they're organic causes for depression, such as anemia. There are a lot of women who have very heavy periods, for instance, become very anemic, can become very tired and fatigued and feel depressed. They'll be prescribed an antidepressant and they won't feel any better. I think a lot of psychiatrists don't test enough for the organic causes, and that's where people can get into trouble. So it's really important to decipher, as a psychiatrist, to decipher what else is going on. Is this hypothyroidism? Is this anemia? Is this lupus, an autoimmune disease, and so on? Um, yeah, so
And
I think our role has changed in a way that yeah.
I have a question there then. Does the kind of depression that accompanies anemia or autoimmune disease or hypothyroidism, does it look the same? Because one of our dear friends here at Make Your Mark Global is Dr. Jill Stocker, and she regularly tells about her hormonal awakening. She was misdiagnosed with depression, and when she met a physician who saw her at a conference kind of looking cold and wringing her hands, the doctor who is trained in age management medicine said, "Your thyroid's off." And like that, as soon as she was brought into the therapeutic range with her thyroid, the depression was gone. And I noticed the same thing with me, that when I got treatment with thyroid medicine, the kind of low blue fatigue kind of feeling like life is drudgery, it went away. So what would a person, even just somebody who's listening, what would they know in themselves? Is there a difference that we can tell between the type of depressive symptoms that you see?
Well, I think a lot of times they won't respond to the antidepressant, for one. they won't feel better. And so rather than get depressed and hopeless that I'm never going to feel better, really pursue your physicians to look deeper and see if there is anything else going on that could be causing these symptoms. Um, you know, what happens is you feel very low. Let's say you're anemic, your blood count's very low, and no one's checked it in a while. You're so tired, you don't feel like getting off the couch, you really don't feel like engaging with your kids anymore, you don't want to go shopping, you don't want to do the things that you used to do. All of these symptoms are very similar to a major depression and can be easily mistaken as such. So it can feel very much the same. And then if you continue to feel like this for long periods of time, you can actually lapse into a major depression because you get very discouraged. Um, I think people need to really push their physicians to look deeper and further.
Yeah, absolutely. Well, we've got a comment from Charisma who says, I'm so glad that you're looking at the whole person. And Ange says, thank you for acknowledging this. I had severe anemia for a couple of years without knowing it, and it definitely affects mood, state, and energy. So
Mm-hmm.
these are some of the things that we need to be aware of. Now, I shared with you this idea of someone feeling hopeless, but beyond just the hopelessness, a lot of people, including suicide survivors that I've spoken with, they have shared that not only is it hopeless, they have these thoughts that the world would be better off if they weren't in it, that their kids wouldn't be burdened by them anymore. And I also feel like, okay, you might think that's quote unquote true, but I also feel like it's very distorted thinking. Can you
It is.
talk about what happens in the mind of a depressed person and how we can sometimes get completely distorted and even untrue thoughts?
Yeah. Well, if the depression gets severe enough, um, and you're isolated in your thinking, you might even be withdrawn to a certain extent. You feel disconnected from everyone. That's when you get into the danger zone, and that's where your thoughts can become psychotic, or you lose touch with reality. And and it becomes much harder to treat a depression that has psychotic symptoms, where your thinking is so negative that you feel like there's no way out of the situation. Um, it's it starts very slowly too. So if you see somebody that's withdrawing, it's very, very important that you get them to reconnect with themselves or with a healthcare provider. Um, Especially in the healthcare, you know, physicians we know have the highest rate of suicide. And over 400 physicians kill themselves every year. And the numbers just keep getting higher and higher. And a lot of this might stem from the overwork, the repeated trauma, and isolation. If you're working 100 hours a week, you don't really have a lot of energy for much else. And they can easily slip into these states of hopelessness where they feel trapped
Yeah.
because they're financially burdened. Um, they may be abused in some way at work or at home, and you feel like there's no way I'm going to get out of this. Um, but one has to remember there's always a way out, um, that our situations are temporary and not permanent. And, death is not the answer,
Mm.
but it's very hard to see that when you've gone very deep into your depression.
And so, for someone who may be listening and feeling
Mm-hmm.
that sense of hopelessness, you're saying to reach out. I have recommended that people reach out to a suicide hotline, to reach out to
Mm-hmm.
a friend. Um, how would you suggest if we, as a friend or family member, want to check in? Like I've heard from people say, oh, I knew that so and so was really struggling during the confinement with the lockdown of quarantine. but I didn't know what to say. I didn't want to offend them. So, what would you say to us if we wanted to check in on someone that we think is really falling into that dark, depressive place?
That's really, really tough. I think in a way you're going to have to push yourself on them a little bit, you know, and, and, and don't worry about offending them. And let them know that you care. Let them know that you've noticed changes because oftentimes it's other people who notice the changes, not the person themselves. And maybe if you just bring it to their attention that something has shifted and that you're concerned and you're willing to go with them to seek therapy, to talk to someone, let them know that you're there. You know, it's not good enough to send a text. It's not good enough to just send a message on Facebook. I think a lot of people are really suffering alone, and we know that loneliness is deadly in our society right now. I think we have this false sense that we're connected to hundreds and thousands of people, but you can feel very much alone. Um, Even though the numbers are high, um, you don't have that connectedness. And with the pandemic, it's even harder to feel connected. But I think people are realizing that now, and they're having deeper conversations and they're connecting on Zoom and things like that, which is a little different. So I think in some ways the pandemic has brought people closer together and feel a little bit more connected, but we still have the same issues of loneliness.
So, pick up the phone.
Pick up the
You know,
phone.
these days, no matter where you are in the world, there are free apps where you don't even have to worry about long distance charges. So pick up the phone, call, and actually check
Yes,
in. And don't be afraid that you're going to offend your friend or loved one. In
right.
fact, it will probably be perceived as caring, and at least it can open up a dialogue.
Absolutely. There are people who've stopped themselves from killing themselves because someone called them at the moment they were contemplating it. So that one phone call could really make a difference.
So let's shift gears now. You embrace an integrative and a holistic approach, which I absolutely love. And
Hmm.
you also use some somewhat non conventional forms of therapy in your day to day practice. So, in addition to being a psychiatrist, you really function as a coach and a therapist, favoring
Hmm.
more therapy than just writing prescriptions. And part of your therapy includes expressive arts and
Hmm.
creativity. So, tell us a little bit more about how you, as an artist, and you're reviving that side of you, how you
Hmm.
bring that into the therapeutic relationship to help people with their mental health.
Well, first I'll tell you how art actually came into my life. Early in my life, I was a fashion designer. I went to Parsons School of Design, but I had this longing to be a doctor. Went to medical school, and didn't touch anything artistic. You know, occasionally a drawing here or there of anatomy to help me remember things. Um, and I put it aside. But then as I worked as a physician over time, I began to burn out. I felt like something was missing in my life. And I started to buy the works of other artists. And my daughter said to me, Mom, you can do that. She literally said, you know, stop buying art and start making it. And so I actually took her advice and I joined a group in Brookline, Massachusetts, and we painted one night a week. And it opened up a whole new world for me, and it literally awakened me in such a way that it was healing. And I had an experience where I had been ill and I took self portraits while I was sick, and then I painted them.
Mm.
When I recovered, I painted these self portraits and it felt very cathartic. I felt like, you know, it was a release, a complete release. And because it was such a significant turning point for me, I started to think, well, how can I incorporate the arts into my work? I had always loved the work of art therapists and expressive artists, art therapists. And I always saw how the patients, no matter how sick they were, they would light up when there was music or dancing or art. And I said, you know what? Because I'm an artist, I've got to bring this into the work that I do. And so that's how it's evolved. And over the past 3 years, I've done drawing workshops for clinicians, other psychiatrists, to help them get in touch with their own creativity and also for them to incorporate it into their work. And the way that I work with patients is, some of my patients are creative people, they're actors or artists. One is interested in photography. So I might give a little assignment, bring next week, 5 photographs that describe a typical day for you, or 5 things you're grateful for. Just photograph them and bring them back. Or we might do Zen drawing, which is a form of Zentangles. That's another, form of drawing that has been found to lower stress and relax people. So might have writing assignments too. So those are things that I use to incorporate in the treatment and the therapy, and it seems to work.
Yeah.
It makes me happy, so it makes them happy.
Well, as you know, our stories are so very similar. My burnout
Mhm.
wasn't just from practicing medicine. At the same time that I was running a wellness center, I was also doing a TV career. And
Yeah,
like you, from the time I got into medical school, I wasn't doing as much of my creative arts stuff, the expressive
yeah.
arts. And I just took a serious nosedive into the world of depression again. And
Mhm.
I was very grateful that the COO of my company once pulled me aside and he was like, "Hey, Dre, are you singing?" And I'm like, "What?" He's like, "I just noticed that, when you sing on the weekends or whatever, you're in a much better mood." And I'd actually heard that from other people, and it
Yeah.
just, as smart as I thought I was, I never connected the fact that the arts are things that we don't have to pursue just for a career or to show to other people, that it's
Right.
healing and nourishing. And for me, it's a way of moving energy through me and relating to my heart and soul in a way that
Yeah.
nothing else in the world does for me.
Yes, absolutely. My daughter used to tell me, "Mom, I think you need to go to the studio."
Oh,
Yeah, it definitely makes a difference
our
too.
children. So I
Yeah.
love that you bring that into the therapy room. Like, you're asking people to incorporate positive psychology. So rather than just
Yeah.
writing about a gratitude exercise, inviting them to do it in an artistic way is really clever and
Right.
unique.
The other thing I want to add is that the World Health Organization has actually said that art is very beneficial. And a lot of people in the UK are actually prescribing art as a form of treatment. Going to art museums, actually, art galleries, and things like that. There's a huge movement called graphic medicine where, people are actually illustrating stories of illness and recovery and things like that through art. So they've also found that if you draw something, if a doctor draws a diagram of a surgery or something, the patient's more likely to understand it. And you're also better able to remember things as well. So drawing is just, it's something that we've done from the beginning of time, and we have forgotten as we grow older and become adults. We somehow become very disconnected from it, but it's actually very important to our communication
Mm. And also communication just with ourselves. I find that with
and your heart.
with art, you end up bringing things from the subconscious, things that have been hidden in your shadow,
Absolutely.
right? And isn't it a less confrontational way to kind of review past trauma and
Absolutely. Not everything can be verbalized. And there's no accident that the word art is contained in the word heart.
hmm,
Yeah. So it definitely is an expression of what's in our hearts.
yeah. So we've talked about how if you're dealing with depression and anxiety included, you should really talk
Mhm.
to your doctor or a psychiatrist about looking for organic causes,
Mhm.
things that maybe you've never known that you had, like anemia, like an
Mhm.
autoimmune condition, like a hormone imbalance.
Mhm.
You've also talked about incorporating expressive and art therapy,
Mhm.
creativity. And I love that on your website, you
Mhm.
are gifting us three ways that we can really tap into creativity and create our own coloring book. Do you
Right.
find that like the physical, the manual manipulation, whether it's writing or coloring, that also
Mhm.
helps to sort of channel our energy?
Absolutely. Absolutely. It's very good. It's a very good exercise. I personally love drawing. So, um, I am pushing people to actually create their own drawings so that and then color them in rather than I think there's a component of mindlessness when you just color something in. But if you actually create it and then color it in, it's gonna grab you in a way that you're gonna feel so good when you finish a product. And the most important thing about art is you don't have to be good at it. Just the mere act of doing it, the process is really what's healing. And it
Hmm.
can benefit all of us. But we judge ourselves. And the most important thing is not to judge, but just to just go with it.
Awesome.
Yeah.
So, Isla, do you have any final thoughts that you'd like to impart on our audience as it pertains to depression or anxiety?
I think the most important thing is really to seek help and make sure that you have a good alliance with whoever it is. That's the most important thing. And if you that you feel a connection to whoever you're going to get treatment from.
Excellent. And
Mhm.
if you don't feel connected, I think the
Find somebody
recommendation
else
is find
right
someone else.
away.
Yeah,
Absolutely. Absolutely.
wonderful. Well, I'm so grateful to have you in my world. I have loved looking at your art. I saw your your quarantine zine.
Quarantine, yes.
Yes, and then the beautiful sketches that you did of George Floyd, for example, as a way to
Oh,
um, say their names, and just
oh, thank you.
something about that just really resonated with me when I saw that on Instagram.
Oh, thanks so much. And the coloring book also has some of my original artwork as well. So you
Awesome.
can see. Oh, thank you so much, Dr. Pennington. It was just such a pleasure. I'm so glad our paths have crossed too.
I am as well. So there you have it, my friends. You can connect with Dr. Isla Bates on Instagram at Dr. Isla Bates MD or on her website so that you can download her 3 keys to help you connect with creativity and create your own coloring book and look at her amazing art. I think you will be blessed by that. And listen, my friends, if you are struggling with any sort of mental health challenge, remember that the link around this video, there is a link to suicide.org, which includes a list internationally, globally, whatever country or city you're in, there's a hotline available to you. So reach out, speak up. You're not alone in this, and there is no shame in asking for help. All right? So until we meet again, my dear friends, please remember that you are a gift to the world. So share your presence with passion. Much love.